Thank you so much for having me and inviting me this morning. And thank you all for coming. I know it's a bit of a trek out today with the water. I'm sure everybody has wet feet. But hopefully we can get some interesting discussion going. And I'm looking forward to hearing your perspective on my work today. So the title of my presentation, which is not the title of my dissertation, is Making Food Decisions in Opsogenic Environments. So I'm looking at understanding how food service workers make choices in regards to food consumption in their workplaces. So the title of my dissertation is Serving the Fast Food Nation. Okay. So what I'm going to give you today is just a little bit of a taste from my dissertation. So a few of the findings that I found. I'm going to focus a little bit more on the qualitative side because that's where some of the really interesting findings emerge. But I'll give you a few statistics to ground the work to start out with. So my question to start off with, and this might be the teacher in me, I like to keep things a little bit interactive. So I have a question for everyone. Is fast food and restaurant food making us fat? What do you think? Is that too simple?
Yes.
Yes? All right. Okay, good. Contributing, yes. Okay, good. So we have a general consensus in the room that yes, fast food can contribute to the obesity crisis here in Canada. So I'd like to start off by grounding this a little bit within the media. I'm assuming that most of you have probably seen the movie Super Size Me. Has anyone not? Okay, all right, so I'll give a little bit of context. So documentary maker Morgan Spurlock decided to eat only McDonald's for a month, and he consumed 3 meals a day and supersized his food anytime he was asked to consume this food. It's a little bit more complicated than this, but this is sort of the basis of it. And in the end, he went back to his doctor, and his doctor said that he had gained weight, his blood pressure was high, his cholesterol was through the roof, and his kidneys would start shutting down. So it was a very dramatic look at McDonald's and this idea of fast food consumption in America. On the other hand, we have Tom McNaughton, who did the movie Fathead. Now, this documentary is a little bit less seen, but what Tom did was he went out and essentially did the exact same thing as Morgan Spurlock, but didn't supersize, ate kids' meals, and counted his calories while he was consuming the fast food. So he regulated his McDonald's intake, however, he still consumed McDonald's 3 times a day. Tom lost weight. So this was a bit of a counter critique of what we usually frame as the obesity crisis. And a theme emerges when you look at or do a little content analysis between each of the documentaries. And this theme is the role of agency. So how do we choose what we eat, and how do we make informed choices surrounding fast food? So can it really be this simple? That's what my dissertation asks. So as a sociologist, I tend to like to view myself as being a critic of society, or a critic of other sciences in that sense as well, too. So we do have this emerging idea that Morgan Spurlock and like-minded people present that fast food is something that is making us fat. The obesity epidemic has framed fat as bad. So in recent years, we would think fat as bad as being something aesthetically unappealing. So we used to say that fat is bad because it's ugly. In the early 2000s, there started being this ideological shift towards accepting fat and all body sizes aesthetically. However, in the media, fat was now framed as being unhealthy. So we have this rise of the obesity epidemic, and one of the main villains within this epidemic is the fast food sector. So what we medically know about weight gain is that if we consume more calories, generally speaking, than we burn, we are going to gain weight. If we consume fewer calories biomedically, we probably will lose weight. So where I started with this work, and I'd like to give a little bit of context about myself. I began working at Tim Hortons when I was 16 years old, and I continued working there until I was 21. And then I spent a summer, I think around 21 or 22, managing an Arby's. So I did a lot of fast food work when I was younger. I also used to be about 100 pounds larger than I am today. So when I started framing this research, I started off with the idea that I wanted to look at a deep investigation of coffee shop labor. But then I started looking through the literature, and I had all of this sociogeographic literature emerge that talked about physical proximity to fast food places. So, for example, Davis and Carpenter and DeLormer do studies that find that living or studying or working near fast food workplaces results in higher obesity rates within those neighborhoods. So I thought, okay, well, working close to these places, what about working in these places? What would we find if we looked at the people who were directly close and directly involved in this type of work? So I also began digging through the social determinants of health literature. Commonly speaking, within this literature, we see a lot of social conditions leading to increased risks of negative health outcomes. So some of these social conditions include being impoverished or having limited access to income. So when you think of fast food work, you think of something that generally speaking is low status and low paying. So I thought, okay, this starts to make a little bit of sense here. A lot of the social conditions experienced by food service workers that directly tie into their form of labor also correlate with increased BMI. So irregular shifts, shift work, high stress demands, and weird time management. Okay. Also, and this is a counter argument that will come up in my research findings a little bit, we've seen new research emerging, specifically Zhang and Wang have been contributing to this argument, that we're continuing to see an increase in obesity. However, as we continue to see this rise in obesity rates, we're starting to see some social factors like income and education wash out in the mix. So we're starting to see these not play a big role in contributing to who's overweight and who's not. So this is my little sociology slide. I'll just give you a little bit of background and I'll try not to get too in-depth here. But the framework that I used to view this through was Pierre Bourdieu's framework surrounding structure and agency, so habitus and field. So he talks about structure in terms of social patterning and how we use our deep ingrained learned dispositions or habitus to navigate patterns within social fields in order to give ourselves power. So he says that specific economic groups, so lower economic groups, have a propensity to choose food that is more calorically dense because they don't have the economic capital as well as the cultural accumulation to be able to make choices that are what he calls lighter and healthier. So another thing I'd like to bring up would be power and the ability to act. So he says that if we have more power within society, we're better able to make choices for ourselves, exercise our free will, and navigate fields. He also talks about the idea of symbolic violence. So symbolic violence is striving to meet dominant societal ideals that are prescribed by dominant elite classes. So an example of this would be, let's say a low-income person striving to achieve a very thin body that we would see from a Hollywood movie star who has access to personal chefs, nutritionists, and physical fitness trainers. Okay? So he says that this striving to meet a dominant ideology is actually damaging to individuals who do not have the power or free will to meet it themselves. Hence the idea of violence. So my research used a mixed methodological approach. I did a bit of logistic modeling using the Canadian Community Health Survey. So I used 2009-2010, which is cycle 5.1. And I also did some qualitative interviews, and I'm currently in the process of extending these. So 2 weeks ago I decided that I'd like to graduate in August and I have a little bit of time, so I do another 25 interviews. So I did 15 at the end of last week and got some great findings that I can share with you today, and I'll be doing another 10 next week as well too. So a little bit of addition there. Another big thing about Bourdieu is he stresses reflexivity in his social research methodology. So what this means is a researcher is supposed to be aware of his or her own position. So when I mentioned I used to work in fast food and I used to be overweight, that is part of my reflexive methodology. He also stresses that combining qualitative and quantitative approaches can help us answer a question in a more triangulated way. So he suggests that by using both of these models, we can better get at a possible solution for a research question. Okay. So I'm just going to come over here for my results and be able to, I'm going to get to some quotes I might want to read in a few minutes, so that's great. Okay, so what I actually found is that the food service worker population, and I framed these as using the NOx codes, so the National Occupational Classification System codes. I specifically took out high-end occupations within food service. I actually wasn't able to narrow down straight to fast food because the codes aren't specific enough, unfortunately. But I was able to take out managerial positions, executive chefs, things like that, and work with kitchen helpers, food counter attendants, cooks, dishwashers, some of the lower-end occupations within the food service sector. So I actually found that they're less likely to be overweight or obese when measuring using BMI. Also, I used self-reported perception of weight as one of my measures as well, too, and within those models, they were also less likely to be overweight or obese than the general Canadian population. So a few contributing factors to this. Mm-hmm.
Quick question. So where did the results come from again? Was it a national survey that you were drawing on, or
yeah,
or maybe you're about to get to that?
Yes, the Canadian Community Health Survey.
Okay,
yeah.
And you could match weight with the NOC code?
Yeah, yeah, yeah. So they were all NOC coded in there, and I could pull out the population, and then I compared to the general database as well too, which is great. So some of the null contributions. First off, the younger age. So the average age of the Canadian fast food worker is about 30.1 years old. That is a lot younger than the average age of the general Canadian worker. So this contributed quite a bit, as we did see that middle-aged workers who were employed within the food service sector were at higher risk of being overweight or obese. Another thing is I also found that smoking correlated with lower BMI within this population. Also, this population is much more likely to smoke than the general Canadian population. And I have some qualitative explanations for this that are really interesting coming up. Another thing that I found is that people were they had a category for people who would avoid food based on fat content, based on caloric content, et cetera, et cetera. And I did find that this population was likely to make food choices based on an avoidance of fat consumption. Another thing that I found specifically was that females were less likely to have higher BMIs within this survey. Also, the fast food or food worker population is 77% female. So this had a lot to do with it, but only for BMI. When you looked at self-perceived weight, the females were more likely to perceive themselves as being overweight than the men, even though when using BMI as a measure, they were less likely to actually be overweight. Scary. So a few risk contributions that I did see, we already talked a bit about middle-aged women. A compounding factor I saw with that was full-time work status. So individuals who were employed within food service, full-time, were more likely to be at risk of obesity. However, this compounded with being middle-aged as well too, because a lot of the younger folks that you see working in this industry are students, they are part-time. Another thing that I found is those who reported being food insecure were also at higher risk of having an increased BMI. Okay, non-single again, and that did compound again with being middle-aged or a full-time worker.
Sorry. Just ignorance-based questions.
No, that's fine.
So I haven't worked in a hands-on way with this survey. Maybe everyone else in the room has. But so how does the BMI get into the survey? Because is that like some sort of external measurement thing, or do people guess their own? And also, you mentioned about food choices that people make, avoiding fatty. Is
Mhm.
that in the survey
Yes.
too,
Yeah.
about food choices?
Yes. The avoiding is in there, so it's something that they ask them. How do you make your food choices? Is it based on avoidance of fat, blah blah blah, and etc. For the BMI, it's self-report, which is something. So they self-report their height and their weight. These are phone interviews, and then they
Were you just
calculate that.
contrasting the BMI with their perceived
Yes.
weight too?
Yeah.
So there are two different questions?
Yes, they're two completely different questions. So they'd say, how tall are you? How much do you weigh? They'd use that to calculate BMI. And then they'd say, would you consider yourself to be underweight, average, above average, obese? Yeah.
I just asked about a label. I'm sorry.
Mhm.
The null contribution, what do you mean by that label? That it wasn't a significant variable in the models?
Yes, it wasn't a significant variable. And it also, it contributed to the lack of risk, pretty much. So when I was using the logistic assessment, it actually decreased the risk factor there.
These are multi-variable models?
Yes. All right, good stuff. Okay, so when I put income into my model as well too, I found out that income was insignificant within the food service worker population. Now I have theories for this from my qualitative questionnaires. However, one of the big things that contributes to this is the fact that although we would consider food service income to be relatively low, oftentimes these are not the primary household incomes for these individuals. So they are students who are receiving support from some of their parents. They are wives who are receiving support from husbands, etc.
There'd also probably be a limited distribution of income within that.
Yes. It was fairly limited, and I did remove a few outliers. However, there were a few people, I think 4 cases within the $250,000 a year range. So this is household income that was reported. Yeah. So there were a few higher income individuals. I took out a $500,000 person. I did take out the 250,000 range, and it still wasn't showing me any difference within the results. So the role of gender, and I touched on this a little bit. I wanted to bring this back to this idea of symbolic violence and the dominant perpetuated ideology within society that women should be thin. So one of my big findings, and I think one of the most scary findings, was the fact that these women are less likely to be overweight. However, they're perceiving themselves as being overweight or obese.
This is less likely than men.
Yes.
Rather than less likely than women not in the past.
Exactly, less likely than men. Yes, exactly. Good. So there were elements within my qualitative interviews of self-regulation. So when I asked people what they were consuming at work or why they were making the food choices that they were, they would often tell me that they would specifically avoid consuming certain items. So things that we would consider in the media to be traditional, or that are presented by the media as being traditionally healthy, like a McDonald's salad or a muffin, were things that these people would often consume. However, they would say, oh, but I avoid the cheeseburger, or I avoid the hamburger or the fries. So it was a little bit interesting, and I spoke with one young woman who was currently working at McDonald's, and she told me that she was gaining a bit of weight since starting to work there. So now she avoids eating the Big Mac, but she eats the muffins at McDonald's because they're healthy. And I asked her, what kind of muffin do you eat? Because I've seen some of the muffins at McDonald's. Part of my research was to go out and do a little bit of recon and, try not to eat the food while I was doing recon on all of these fast food places. And she told me that it was the double chocolate Oreo muffin that she really liked. So this frame of healthy was a little bit off in a lot of respects. Another younger man that I spoke to, I asked him, okay, well, what are you eating at Tim Hortons? He worked at Tim Hortons. He said, oh, I never touched the donuts or, the fatty sauces and all of that stuff. Usually when I'm at work, I have a plain bagel toasted with butter. So this other idea of what's healthy, what's not healthy, fiber content, things like that, they're making assessments based on what's framed as healthy and not necessarily on what experts would call healthy. So I had a few very interesting cases here. Now, this idea of habitus that Bourdieu presents is that our long-term ingrained dispositions tend to dictate our taste for certain foods, musics, education systems, etc., etc. So when looking at this population, I started looking at their habitus or their disposition. Now, he also does say that habitus can change over one's life course. Now, this change comes from involvement in different social scenarios, different workplaces, different schools, etc. But I did find, generally speaking, that people's childhood exposures carried through to their adulthood consumption choices as well, too, within food service. So, for example, I had one young man who grew up in a very marginalized household. He grew up on reserve with limited access to clean drinking water. And he talked to me about eating Kentucky Fried Chicken, McDonald's, pizza fairly regularly at home because there wasn't a lot of access to grocery stores and what we would consider to be healthy food. Now, making food choices within McDonald's, his current workplace, he talked about finding things at his workplace that were discounted, so offered to him at 50% off, and things that we would consider to be cost-effective that would fill him up the most. He also experienced some weight problems that we're going to talk about as we go through this as well, too. So I also talked to individuals as well, too, who were raised on social assistance, who were raised eating very processed foods. And again, their ideas of why they consumed what they did tended to flow around this notion of something that's cheap, easy, convenient, and can fill them up the most. So there was also this very temporary view of the workplace that emerged. And I call this the protective habitus. And this shielded people from ingraining the culture and the values within their workplaces. So in this extended run of interviews that I did this week, I was working with UW undergrad students to ask them about their workplace experiences. And many of them said to me, "Oh, I would never work there in the future." And actually a lot of them had some very derogatory terms for the individuals that they called to be lifers. They were described as sad, weird, unfortunate, losers. And none of the individuals that I interviewed said that they would ever aspire to be in this form of workplace. I only had one young woman out of the 14, 15 people I interviewed this week who said that this type of work is socially acceptable. So we have this very stigmatized view. Also, what's presented is even the individuals who are in these types of workplaces for what we would call the long haul, the lifers, these individuals still discuss on a daily basis leaving. So they say, "I will be going back to school next year. I'm looking for another job. I need to find something better for myself." But when asking my research participants about these individuals, they often said, "Oh no, I still go back to McDonald's when I'm at home and Jack's still working there." So it's this idea of wanting to leave because of the social stigma placed on this type of work. So I argue within my dissertation that this protects individuals from acquiring a habitus or dispositions that would normalize this type of food consumption. Oh, yeah.
Do you think it would have changed if you had done interviews with people who worked at university now? I'm thinking about new immigrants and also in small towns where there aren't that many job choices, and so the value of one job might be different relative to what's available.
Yes. Actually, my first run of interviews was with non-university students, and a few of them were new immigrants as well too, and some of the university students that I'm researching as well, quite a few of them are newcomers to Canada as well too. But it was this view as well too that, oh, I'm going to get out. It was a stepping stone type job position. It wasn't something that was permanent. So it was something that I did see as well in the first round of interviews, which was great. Okay. The last thing that I found really interesting, and I know it's not the title of the talk, this is Phil Bigelow and I are working on constructing a paper surrounding this. It became its huge theme of its own, was smoking within the fast food industry. So research in the past has shown us that food service workers are more likely to smoke, And my quantitative results confirmed this as well, too. When I did my interviews with people and asked them when they started smoking, many of them said they started smoking while working at these fast food workplaces. So as somebody who's been in this field for years and been able to see how this develops, I do understand this because you're working very, very fast-paced, long shifts. And a lot of these individuals were actually using smoking to get an extra break. So they were able to go outside, they were afforded a chance to relax. The other thing, too, is there's a high smoking rate within managerial positions in fast food workplaces. So when popping out for a quick cigarette break, they would often come into contact with their manager or go with their manager. And they all discussed these social relationships favorably. So when you're standing there having a casual, informal cigarette with your manager, you are able to become buddies with them. And then all of a sudden, you're not working Saturdays anymore. If you need full-time hours, you're receiving these. So in a sense, it afforded these individuals a better field position or more power within the fast food workplace. So that was something really interesting because usually, from a health perspective, we see smoking as a disadvantage. And I would argue it does, obviously, health-wise, disadvantage these workers. However, there were actually advantages to them picking up the habit of smoking. So I'm going to leave this. This is more something that when you receive the slides, you can take a look at. These were my participant characteristics for my first 15 interviews, and I'm happy to send along the subsequent 25 when I get the chart typed up for all of you. So I just wanted to give a little overview of the different types of workplaces. We have Burger King, McDonald's, Subway, Tim Hortons. And it was actually interesting speaking with the Subway worker because Subway is something that traditionally is framed as being healthy. And she would argue that it really wasn't healthy and that she was eating things that she knew she shouldn't. However, she also said that she became slightly addicted to Subway and now goes out and purchases it, even though she's not working there anymore. So some interesting thoughts from these, but I just wanted to give you a few of the demographics. Okay, so I have a few quotes for you. A lot of the dominant views on weight that these workers held is that weight is unhealthy, it's bad, and that being overweight is not something that we should ascribe to be. So I had a case of two individuals. One of them was a newcomer to Canada. The other one was the young Aboriginal man who grew up on reserve, who were both living in, let's say, a medium-sized urban area in southern Ontario. And they both worked at the same McDonald's in a very busy, I would say, largely impoverished area. Both of them had very high BMIs, and one of them actually experienced reproductive health concerns because of her weight. So I discussed with them their weight, and I asked the question, have you ever gone on a diet? They both brought up to me their manager. Now, their manager was talking to them about, I believe it's Arbonne. It's one of those fad, shake, drink, pill type programs that you can purchase in order to lose weight. So both of them talked about consuming food at work because it was cheap and it would fill them up and save them money because it was 50% discounted. However, they also talked about ordering these very expensive diet systems suggested to them by their managers that essentially they could not afford on their income. So when I interviewed these individuals, and I'm thinking about emailing them to follow up if ethics lets me, to see if they did use the system, if it did work, they had both spent the money and ordered these systems for food supplements because they thought that this would make it harder for them to eat at work and it would be some sort of miracle cure. Okay. There was also a general theme of getting sick of the food at your workplace. So this was another thing that emerged qualitatively that contributed to these workers not consuming this caloric food that we tend to associate with weight gain. A lot of them said if you're around the food all day, you smell like the food, you serve the food, you smell it all day, you eat it all week, Eventually, you just don't want to eat it anymore. It makes you sick. So this was another thing when we talk about the overconsumption of food. Now, this is the Subway worker who said, I got addicted to it basically. Honestly, I want it all the time now and I can't get it for free. So she was consuming on every 4-hour shift a free half a sub and on every 8-hour shift a free footlong sub for an entire 2 years, 5 days a week. She said she didn't miss one of her free meals. So now that she's no longer working there, she still does want to consume it. However, this was not the dominant view surrounding this food. Most people said that they were sick of it. However, when I followed up and asked them, okay, do you still eat the food now that you're sick of it? Most of them said yes, because it was cost effective for them. Okay? So this food is being offered to workers, sometimes at a heavily discounted or free rate. So that brings us to the cost of food. Good tie-in. Great. So I'd like to read you a quote from one of my workers. Now, this person was someone who was raised in a very low-income home. He was claimed to be taking a few years off before he enters college to figure out what he wants to do with his life. So he was still a fairly young gentleman. And he said, cost makes a difference. Yeah, oh yeah, I use the discount. For sure, every dollar helps. And I guess I try to look for stuff that's not going to make me sick. Not a lot of things do, but I will eat something and then I eat more and then I have a coffee with it and then I have a smoke. It doesn't quite sit well. So he would specifically look for foods within the workplace that did not make him ill, although he kept eating there regardless. So I asked this individual about going to look for other food, bringing his food from home or seeking out food from a workplace nearby. And he said, oh yes, we have a Subway next door. Sometimes I will go over there, but it's expensive. Why would I spend the money on this when I can get Burger King for 50% off? Then when I asked him about, followed up and said, okay, well that's fair, but bringing food from home. He told me, well, with the cost of the food that they're giving me at Burger King, it would actually cost more for me to prepare a meal at home and bring it with me. So it's this perceived idea that the food is so cheap that they can't help but consume it. Another big thing that came up was time consideration. So from the same workplace as this young gentleman, so I should mention I used a snowballing sample for the first 15, so I gained access to one individual and then they would give me phone numbers and emails to other coworkers. So I had quite a lot of the same people, or quite a lot of people from the same workplace within the different chains. So this person as well talked about McDonald's across from a Subway. And he said, but during my work shifts, I would usually eat McDonald's, just because there was really not a lot of options. Occasionally, like very rarely, I would bring something. There was a Subway across the street, so obviously that was a healthy option. I would sometimes eat there or get someone to go over there, or go over there depending if I had any time. Or occasionally I would bring food from home. But because it was 8 hours, I would usually end up eating at McDonald's at least once. So time was a big consideration as well, too, with these workers. So they would say, even if I did bring a snack from home, I'm working an 8-hour shift, I'll, generally speaking, get hungry at some point and eat something from the workplace. Another big time consideration within this type of workplace is the fact that we would consider this work to be irregular. So these workplaces are based on supply and demand. And the main cost of operating a fast food workplace is service, right? So oftentimes when owners are trying to save money, if the restaurant is dead, they'll send somebody home early. Workers tend to pick up the ebbs and flows that go along with the workplace. So for example, and I learned a lot about the different discount deal days while I was doing this research. If you're working at a Burger King, you're probably not going to go home early on Whopper Wednesday because everybody comes in for their $2 burger, right? However, you may be going home early on a Monday night because that's not usually when people go out and consume fast food. So workers would often guess how long that they'd be at work and anticipating that they'd be sent home early to save their employer's labor costs. When this wasn't the case, they often wouldn't be able to have food from home because they didn't anticipate staying at work that long, and they would consume a meal that was made there. Okay. So this just goes into a little bit about workplace conditions as well, too. And I'd like to talk a little bit about the areas for eating. I'm going to let you read this big, dense quote about speed of service and labor. But the areas for eating that are provided to workers while they're at work. So the break times for these workers, generally speaking, tend to be about 15 minutes, half an hour, depending on where you work and how long you work. A lot of these breaks are unpaid as well, too, and they're timed. So when workers leave the floor for their break, a supervisor will click on a timer, and as soon as that timer hits 15 minutes, they're being called back in to work. Now, oftentimes the break rooms in these areas are extremely small and they're within the kitchen. So there's not a lot of space to really leave the workplace during your break, not a lot of place to enjoy your meals. Another big thing that's emerged in this second round of interviews that I've conducted is lack of fridge space for workers to actually provide their own food while they're at work. So you think the back of a fast food shop would have a ton of fridge room and freezer room. They do, a lot of them do, a lot of the ones that I've worked in do. However, the management will specifically put policies in place to not allow outside food within their fridges or freezers, therefore not allowing people to store any type of food that needs to be in certain temperate conditions. So this was an interesting thing as well, too, that prevented a lot of workers from bringing food outside of the workplace in. So other views on work were these negative views towards actually being within the fast food sector. So one worker said, oh yeah, I definitely don't want to be in fast food anymore. So I'm working extra hard in school. It's just like a nightmare getting away from it. I want to be working for a company, hopefully in my field. I don't know specific job titles or descriptions yet, but definitely what I'm doing in school now. So this idea of escaping the workplace emerged. And when I asked this individual if she thought that the food that Harvey's had framed as being healthy was actually healthy, she said, no, I've done my own investigation. I don't internalize these views that this food would be considered healthy. Last theme that I found through my qualitative interviews was this idea of self-regulation. So a lot of the workers did regulate their food consumption based on what they perceived to be healthy, and also based on what dominant media ideology would tell us would be healthy. So their reasons for avoidance for most of these workers was to avoid weight gain. A few of these workers spoke about avoiding sodium, avoiding high fat content, etc., but generally across the board, it was avoiding weight gain. So this idea of regulation is often in line with the views perpetuated by the people who frame the obesity epidemic politically. So this idea that we can exercise our own free will to make ourselves thin, and that the onus is on us to make healthy choices in order to not gain weight, was really perpetuated within this population. So they wouldn't say, oh yes, well I know I'm surrounded by it all day and the advertising for it, so I can't help but eat it. They would say, if I choose to consume this food, it's my own fault. So I need to make better choices that will lead to me losing weight or maintaining my current weight now. So a few things that really hindered my study. There's always some limitations that exist when we do this type of research. So a big thing that hindered my study was the Canadian Community Health Survey. There's not a lot of great surveys out there right now that have specific occupational codes that you can work with. So unfortunately, I wasn't able to narrow down within the survey specifically to fast food frontline workers. So they are framed as food service workers within my dissertation. And again, I was able to pick out lower end occupations within the industry. However, I wasn't able to separate a kitchen helper at a line restaurant or like family type restaurant from a kitchen worker within fast food. Another thing as well too is the relative youth of the food service workers. So I'd like to see what happens to these workers as they age. However, we're not sure if these workers are aging within this industry. So I would like to get survey data moving forward from earlier cycles to see whether or not we're seeing more and more older workers within this industry. With a lot of economic downturn trouble, as well as an increasing recurrence of people who are retiring and then re-entering the workforce within low-end jobs, I do suspect that this may become a trend going forward in the future. Another thing that I found that was a bit of a problem with the Canadian Community Health Survey is that specifically for students, it was hard to really narrow down what their class was. So oftentimes familial support and household income was reported. The same thing happened with the individuals that I interviewed qualitatively. I asked them what was their class growing up. And they'd say, oh, working class or middle class or upper class. Then I'd say, okay, what's your current class now? And although they were making $10 an hour and living in shared rental accommodations as students, they would still say upper class because that's the class that mom and dad are. Oftentimes, too, they didn't know their personal income. So that was a big thing as well, too. So this goes along with this idea of part-time and temporary work, or temporary work. So just a little anecdote. I was I'm teaching a night course at the University of Guelph on Tuesday nights now. That's why I'm here on reading week. So there you go. And on the way home, I got a text message from my husband asking me to go pick up something for dinner for him. So I thought, okay, all right, can't feed himself, but off to the Wendy's drive-thru I go. And I pick up something for him, and there's this poster hanging up on the window that says, looking for a job to do while your children are at school. Need a job that can fit around your school schedule. Try working for Wendy's. So even these workplaces are framing this type of work as temporary, something that's suitable to do for mothers, students, retirees, people who need a part-time income to supplement, generally speaking, a man's or parental's income within the household. So my conclusions, with the null finding, I originally hypothesized that fast food workers would be more likely to be overweight. With the finding that I did not find that and they're less likely, new questions emerge about who these individuals are and who these individuals will be going forward in the future. Also, questions arise surrounding mental health and well-being within this sector. So a lot of the individuals that I spoke to were highly dissatisfied with their current life position, as well as there is a lot of social stigma placed on these workers. So what does this mean for personal well-being? I think that that's an important question to ask going forward. So other future important questions. Again, while workers age, what happens to them? Do they stay in this industry? And with current economic conditions, will this become more likely? And I'd also like to look at if we can investigate this idea of temporality in different sectors as well too. So specifically going forward, I'd like to take a look at other types of highly stigmatized low-income work and see if those workers are viewing it as highly temporary as well and what this means for their own personal well-being and sense of security.